Oh, I'm Toya White, and I'm supporting the sickle cell walk. This is my niece. My sister has sickle cell, and her 2 twin daughters have sickle cell. And I'm supporting the walk for them, for our family, of what we go through with the pain of sickle cell. We share the same pain. We share pains with them when they go through pains. And this is our first sickle cell walk. People should give blood so it would never be, we would never run out of blood. People always need blood for sickle cell.
Still feeling good, sir?
Still feeling good. Didn't even feel it. She stuck me already. I didn't even flinch.
What do you say to all those cowards out there that are afraid because the needles are scary?
Don't walk in the spirit of fear.
Now, you know, this is one of them surprise things that we do.
How you doing?
What made you want to walk in here today and donate this blood?
Well, actually, a couple of months ago, I was at the pastor's luncheon, and they were talking about the importance of giving blood and how they needed African Americans to start giving more blood, and I never knew about it, and how the people with sickle cell needed our blood because otherwise, if they got other blood, it would make their blood go down. And when I heard that, I said, I got to start giving blood because I didn't know it was a need like that. So I figured I would start becoming a blood donor.
My name is Alicia Black. I am a technician too, which is just a traveling phlebotomist. I wait for the donors to come in. I take you back for the histories. I take your information. I get a little bit of health information from you as far as your weight, blood pressure, pulse, and stuff like that to make sure you are healthy. After that, we come in. If you pass all your screening and information, we bring you out and we stick you.
That's very kind and gentle, as opposed to...
You're going to come in, you're going to sign in. We have a red book for you to read to see there's certain criteria in there. If you do not fit most of that criteria, we call it deferred. So you'll be disqualifying yourself right there. Anything in the book pertains to you, you are to let us know, but if not, then we take you back and we do the history with you. The history takes about maybe 5 minutes, but the total process will take about 45 minutes on and off the bus. So.
Now y'all trying to get my credit history, or you know, what kind of history you trying to get from me?
Just name, address, telephone number, like I said, the health information as far as the weight, the blood pressure, the pulse. What else do we take from you? Your iron level, so we do get a finger sample to make sure you do have the right amount of red blood cells to donate with us today. Other than that, that's about it.
And then the last step, I guess, is to end up in a chair like this guy.
Yes.
Amen to that.
This blood will be, once it's taken here, we cut the needles off here and we pack it in order to go downtown and be transfused, so basically be separated. You have your red blood cells, your plasma, and the platelets. Everything will go to 3 different people. So with 1 pint of blood, you save 3 lives, which is pretty good.
With 1 pint of blood, you save 3 lives.
And the red blood cells are what's going to the sickle cell patients that actually need it for the transfusion.
That's my sister with the sickle cell and her 2 twins. I have the trait, my son have the trait. Yes, because it's not well known and many people don't know they have it. So this walk will hopefully let people know that we're out here to walk for them to have the awareness and go get themselves checked.
Many people with the sickle cell trait doesn't know they have it because they don't have sickle cell crisis and going to a lot of sickle cell pains like the people with full-grown sickle cell anemia.
I'm very glad I'm here today because I have sickle cell trait, and as a young age my mom told us that, you know, that my dad had sickle cell anemia and she didn't have sickle cell trait or anemia, that we could not have a child with someone that has sickle cell trait or sickle cell anemia. So that need to be definitely put out there in the public to be aware of it. That people who don't know that they should get checked, but at a young age they should know, and their mom or dad didn't tell them, but they should know, because bad things can like really happen if both trait or anemia meet together.
I'm Joseph Bland, 11 years old, and I'm out here because I wanted to support people that have sickle cell. My big cousin, Damika, has sickle cell. My auntie and Nola Mika got sickle cell. And my other cousin. I'm Ben, and I'm 10 years old, and I'm out here cause I got the sickle cell trait. Some of my cousins have it. My auntie has it too, and that's why I'm out here. The reason why people shouldn't make fun of sickle cell, cause it's a really bad thing to make fun of people that has it, like, and it's hurtful.
Have you ever seen anybody be mean like that?
Yes.
And how did it make you feel?
Terrible, angry.
So just say one thing to say, you know, that if you could say to get them to stop, what would you say to them?
I would tell them like to stop joking around, cause it's a bad thing. It's a bad thing to make fun of people.
My name is Jermaine Cross. I'm out here supporting my sister. She has full-blown sickle cell, 24/7, never stops. The pain they go through, I go through it with them. You know what I'm saying? I'm there helping 24/7. I wouldn't wish it on my worst enemy. It's important for men because basically they need the help, need the strength of a man. You know, I lost my cousin. That was years ago. Yeah, he was 21. He just stopped taking his medicine because he ain't want to go through it no more. I'm sick of it myself. For the males, you just need to be there. You know what I'm saying? That's all I can say.
Sickle cell is not nothing to play with. Some people through like 20s and like 30s and stuff, they don't live through sickle cell. Some people die like early from sickle cell. And I want to be like really supportive by joining everybody in the walk.
No matter what they go through, whoever it is, I'm there. Because I don't understand that. It's unbelievable.
I'm Demetrica White. I'm 36 years old. I'm out here for the foundation of sickle cell support. I was diagnosed with sickle cell at the age of 6 months as a baby. And I have sickle cell, asthma, and leg off. I have twin daughters with sickle cell SC, and one of them had a cardiac arrest at the age of 6 in 2005 due to a disease and poliovirus. Supporting my loved ones meant to me a lot of support and love, really plenty of help. They're very supportive. KKS Spirits means to me a lot of information and support for the sickle cell. I like to support the sickle cell awareness period. Because of the pain they have, a lot of them don't know about supporting the crisis and all that they have. They don't know what starts it at times and what medicines to take, so it's very important to support them on it, to let them know a lot of information about it. I got the sickle cell disease from my mom and my father. My father and my mom, they have the trait. 2 adults, the trait makes a sickle cell disease baby, and they're here to support me too. Them and my sisters, brothers, and nieces and nephews and friends.
I was really, you know, first of all, my first feeling was shock, you know, and to even hear about this type of disease. And then me and her dad was married, and to learn that, you know, go for your blood test. And back then in 1976 and stuff, it wasn't that much awareness of it and everything. And Dee Dee, of course, had it, you know, from birth, and then the 6 months old was diagnosed with it. Like I said, wasn't that much awareness amongst the physicians and all that back then. It was hurting to find out that, you know, it was what I've learned so far with the disease, all this is, you know, is attached to the disease. At that age, Dee Dee was 6 months, like I said, she was diagnosed with sickle cell, and they was telling me she was dying. And then they asked us, were we married? We had to go and get the blood work, and the test proved that it was sickle cell anemia. Just only one physician knew that, a minority physician back in Detroit. And the rest of them, of course, was telling me that they didn't know what it was. Okay, so, but as far as, you know, since she's been born, she's been a trooper and stuff, you know, all through school and everything, and even taking care of her identical twins here. This is really remarkable to me, to what she can do. When, you know, I watch her every day, and I'm so grateful that she can do what she do with this type of disease, even with the leg ulcer. It's been open now 20 years. I have a large family, 6 adult kids and 10 grandbabies, and we all support her and her children each and every day. And I thank God for that.
What was your response when she asked you why, Mommy?
I always told her, you know, we don't ask why. You know, we don't know what reason why things happen in life, and you know, we just deal with whatever is put before us and stuff. I never questioned him. There's something that was supposed to be, you know, as far as I see, as far as the eyes of the Lord. And so I always tell her, never question his work or whatever. You know, we just deal with what we have to do and do what we can as much as we can.
I'm Alante Wyatt, and I'm 13 years old.
My name is Lawrence, and I'm 11 years old. My name is Tyshawn, and I'm 9 years old.
We are walking for sickle cell. Like, we're walking a few miles just to help people who have sickle cell and help save their lives.
So the people who have sickle cell know that people who are helping them can feel better in their disease.
For to help the people who's sick and who got in bad shape.
What could you be doing if you weren't here?
I'd be walking.
Would you be like playing games and stuff?
No, I'd be walking for the people.
Boy Scouts, like, around here, you don't see many of them. So we want to be like, because we're a small group, we want to reach out to the world so they all would know who we are.
Met Adrian. Wanted to start it on her own since Cleveland Clinic couldn't do it. or American Sickle Cell couldn't do it. She's the only one who's done it so far. There's support for kids, but not adults. The thing I like about it is adults with sickle cell. And I like the fact that adults can get together and talk about things that's going on that is important to them.
Hello everyone, I would like to take this opportunity right now to invite you to our Red and White celebration at Normandy Party Center in Wickliffe. It will be held on September the 23rd at 7 o'clock. I also would like to take the time to also thank everyone for coming out to our Sickle Cell Awareness Walk. It was a great success only because of you. Keep supporting sickle cell anemia. We need it.